bunion is not necessarily a big growth that develops on the inside of the big toe joint. It's actually part of a bigger problem and an arch collapsing very subtly over time. And it drives one of the bones in the midfoot to be pointing in, and it creates that prominence. And that prominence can cause pain with shoe wear. A tighter toe box shoe can put pressure on that. It can be painful with walking and range of motion. If you notice a bunion and it's painful, options for trying to control your symptoms are adjusting your shoes. You could try toe spacers if the big toe is pushing into the second. But ultimately, there's really no conservative fix for that outside of adjusting your shoes, your activities, or trying some of those toe spacers or silicone pads to try to cushion the prominence. If the symptoms are sufficient and the conservative treatment that you have attempted has not controlled your pain sufficiently, really the only definitive way to improve your symptoms is with a surgical correction. The bunion is not going to correct itself, and it is not going to become less painful if it is significantly impacting your quality of life if those other modalities haven't helped. There are roughly 150 to 160 different ways to fix a bunion, from cutting the bone and shifting part of the bone over to make a straight bone crooked to try and fix the bunion. You can fuse the big toe joint to make it straight, or you can fuse a joint further back in the midfoot and correct the deformity through that. Depending on which option you choose would dramatically impact your recovery. The generic answer for bone healing is with a fusion is 8 to 12 weeks. If you do an osteotomy where you cut the bone and shift it over, it can be 6 to 8 weeks. But it just kind of depends on which treatment option your surgeon would recommend and what would be best for you.